Hi everyone, Dr. Alisa Kauffman from Geriatric Household Dentistry in Manhattan, here with Dr. Abby Neville, Geriatric Household Dentistry in Philadelphia and the surrounding suburbs. I'd like to discuss extractions and when we extract and when we don't extract a tooth in the elderly, the bedbound, the homebound. Sometimes they're in a chair, sometimes they're in their recliner. We can work on you anywhere.
Yes.
We have our own light, we have our own equipment, and we really don't need anything from you but space.
Yeah.
So we are going to talk about extractions. I have had numerous people call me saying that they brought their parent, their mother, their father, their husband to the dentist, and the dentist said that all of the teeth needed to be extracted. And they wanted a second opinion from you because you're a geriatric dentist,
Right.
so maybe you're a little more conservative. Maybe they want to hear something different.
Right.
Sometimes we agree, sometimes we don't. Do you get that a lot?
Yeah, I do. I get that a lot, actually. And they don't always have to come out, number one. Sometimes root tips are very happily sitting in the gum tissue, in the bone, with no infection. Nerves are calcified, and we can leave them there. It's totally safe, and sometimes it's actually the safest for the patient, right? Because they're so medically compromised, they're bleeding risk, and so sometimes the safest thing to do is to leave them in place and not take them out.
Exactly, I agree 100%. And that's the difference between our skill set and maybe your general dentist skill set. Because if something's broken, it shouldn't be there. Sometimes if it's broken, you want to leave it alone.
That's right.
How about when there's pain involved? Are you able to do an extraction safely in the home?
You are, absolutely. When there's pain involved, that usually means there's infection there, and that's a dangerous situation. So we do want to take the tooth out in a situation like that. However, we're going to do a thorough medical history. We'll talk to the primary if we need to. We'll talk about medications. And so if we need to, we can, absolutely. And we can control the bleeding well too.
Right. We have special stuff that we stick in the hole.
Yes, we do.
And you don't have to worry about the bleeding. So when you are going in to do an extraction, you've done a thorough medical history.
Correct.
If there's any questions, we ask to speak to the
do.
physician. We know everything about the patient. We know if they've taken biphosphonates. We know if it's a male or female, if they've taken, I think only male, Exgiva, which is for prostate issues. So I don't think women have that problem. But if you have taken Exgiva, you will never heal. And we probably wouldn't want to be the dentist to go in there
That's right.
and do anything to you. I mean, if you're in pain, we probably will send you to the hospital and they will control the situation there. So there's all different kinds of situations that we're able to handle, but 99% of them we can do in the home.
That's right. I mean, she brought up the male version. We have a female version, which is like the bisphosphonate therapy. There are a lot of patients, elderly women, that have osteoporosis and have been taking these types of medications to strengthen their bones, but that does affect the jaw in a very different way. So when we go to think about doing an extraction, we think very carefully about whether or not it's warranted or not because of that medication. And that's something that some people don't know and would go ahead and do an extraction and not understand the potential risks of doing that.
So we are highly trained and we know our stuff. If you're on blood thinners, we know it. If you're on aspirin, we know it. Sometimes we have to take them off and sometimes we don't.
And there's all kinds of different blood thinners, right? So some of them they do have to come off and some of them they don't anymore. And we know the difference between them.
And we are talking to your doctor because the last thing we want to
That's
do
right.
is get into any trouble in the homes. And
That's
37 years. How about for you?
Yeah,
right?
no, not
yet. So we're here to help. We want to make sure that if you need an extraction, that we do it in the safest way possible. We have special injections.
Yes, we do.
And we're not giving away all our secrets in case other dentists are listening.
That's right.
But we have special injections, special ways of injecting.
Mm-hmm.
And we are there to make everyone as comfortable as possible without causing any other kinds of risks. And just give us a call. Check out geriatrichouseholddentistry.com. Thanks for listening.